we are cancers. It's Adam Feryn, Justin Grosswiener, and Maxwell MacKay. So the main issue that we wanted to cover is that cancer is basically one of the most vicious diseases in the world, and at any given time in really anyone's life, they will have an experience or an encounter with it. It's pretty much unavoidable, whether it's someone they know, a relative, or even themselves. And it's so common that the World Health Organization, WHO, reported that in 2018, cancer was the second leading cause of death globally and accounted for 1 in 6 deaths worldwide. There are many causes to cancer. It can really appear in a lot of different ways, but some of the more common ones are genetic factors that can put people at risk for inheriting the disease, and lifestyle choices or ways that people are stuck living their lives that put them at a much higher risk of getting cancer. While many people hold sort of a it won't happen to me, or oh, they know how bad the disease is, but they're really sure that they live a healthy lifestyle, they're not at risk. Based on the research that has been done, it is very likely that people will have an encounter with cancer in their lifetime, and it is entirely possible that that encounter will be they themselves getting it. So for this presentation, we sort of want to just go over how a lot of these things can be avoided and different ways that we can go about that, because cancer can be a very frightening subject, and especially when people have that attitude, and it can sneak up on them, and it can be very frightening and create a sense of panic without the correct information and awareness. So we're making this presentation to help people realize this diagnosis is not the end of the world, especially when it's caught early. Also, we want to explain a strategy that we think will help prevent cancer from having such a detrimental impact on our society.
So funding for cancer treatment and research has been the target of many fundraising campaigns and lots of like social movements. And we agree that cancer treatment and research is very important in battling this disease. But we think taking an informative and preventative approach can reduce the number of people that not only die from cancer, but also get diagnosed with it like to begin with. So we plan on doing this with our recommendation by increasing access to free cancer screenings. A lot of people can't even afford them in the first place. And we want to raise awareness of warning signs to increase early diagnosis. A lot of that, like the breast cancer is a very good example of that. A lot of like awareness about checking for lumps and things like that. But we want to like prolong that to just, if your body's feeling off, maybe get it checked out, and that can lead to a lot of catching it early. And we want to change that public sentiment about it won't happen to me, because as a lot of people come to find out in their lifetimes that they have very firsthand experience with it, whether it's them or a close loved one. And then we want to teach people about just healthy habits to prevent cancer, like wearing sunscreen when you're outside and eating healthy foods and exercise and just living an overall healthy, active lifestyle.
Yeah, so I'm going to go over how our proposals would have an impact. And as Adam talking about, cancer screenings are very expensive. They can be up to $1,000, from maybe $500 to $1,000 for the first scan, but that's just for the first scans. For the follow-up tests, it's going to be even more expensive. So while you could lower these costs, it would allow for more people to have treatment and not kind of be untreated because they can't afford the programs and the scans. And yeah, so raising awareness can help prevent cancer by showing people what the warning signs are for early diagnosis. And while there already are a lot of cancer awareness months, there's basically a different cancer for each month. I think institutionalizing the awareness of these different cancers and the early signs would be something that would be very beneficial. Doing it in schools, getting people knowing about these things from a young age, even though it might be years away, knowing what they have risks for would be helpful down the line. And then changing the sentiment of it won't happen to be attitude. According to cancer.gov, about 40% of people will develop cancer at some point in their lifetime. So that attitude is definitely not correct, because not 50-50 chance, but pretty close to that you will end up with getting cancer. So raising the awareness of that and kind of helping people understand that it is something that might face in their lifetime is going to be something that could prevent long-term cancer health. And as well as teaching people to have a healthy lifestyle. As of course, that is something that is still done in schools and institutionally, but 30% of people are 30 to 50% of cancers are preventable according to the WHO website. And a lot of these can be prevented by healthier lifestyles. So something that we could definitely put a bigger influence on, not using tobacco, eating a healthy diet, maintaining healthy weight with exercise, protecting yourself from the sun, vaccinations, safe sex, and just regular check-ins and healthcare. And while all these things are sort of little things, together they can add up and make a big difference. There isn't one big fix to solving cancer deaths around the world, but teaching people to have healthy lifestyles and raising awareness and getting people to understand that some people are at more risk for others will help lower these deaths overall.